According to the CDC, there are 51.4 million surgeries performed in the U.S. annually, 4 million of which are open abdominal surgeries. Nearly 80% of skin closures for abdominal surgery are performed using staples, which produce track marks and scarring. Studies show that patients are highly concerned about scarring following routine surgeries, with most patients valuing any improvement in scarring. When it comes down to it, the better they look, the better you look. In the Journal of Plastic, Reconstructive, and Aesthetic Surgery, updated scar management practical guidelines for non-invasive and invasive measures suggest that strategies to minimize the risk of scar formation are applicable to all types of scars and are indicated before, during, and immediately after surgery. The Scar Management Practical Guidelines recommend reducing skin tension, which is a proven trigger for hypertrophic scarring in clinical trials. Furthermore, the guidelines advise that the first priority following surgery should always be the prevention of abnormal scar formation. In the case of an operative procedure, scar prevention measures should be initiated during or even before surgery. In elective surgery, the position and the length of the incision line should be carefully considered and, if possible, should always be parallel to the relaxed skin tension lines. Dr. David A. Shifrin is a board-certified plastic surgeon, respected for his work with cosmetic surgery. An award-winning surgeon, Dr. Shifrin is a fellow of the American College of Surgeons, a member of the American Society of Plastic Surgeons, and the highly selective American Society of Aesthetic Plastic Surgeons. Also an assistant clinical professor with the University of Illinois at Chicago Division of Plastic Surgery, Dr. Shifrin specializes in cosmetic surgery of the face, breast, and body. Dr. Shifrin has agreed to share some best practices in enhanced wound closure techniques specifically for abdominal procedures.
Hi, and thanks for joining me. Having performed both surgically necessary and elective surgeries, I'm no longer surprised when I'm asked about the potential scarring related to the surgery. And based on the number of scar revisions I do, I've come to understand how important minimizing scarring is to patients and how it impacts the way they perceive the total surgical experience. In alignment with the Scar Management Practical Guidelines, I have seen firsthand how tension reduction, both in layered closings and at the skin junction, can make a significant difference. The guidelines advocate the use of subcutaneous sutures to relieve the tension from the overlying skin, given that the procedure involves stretching the skin. The closure technique I am going to share with you today is based on these principles, as well as years of experience and refinement. To offload the tension on the overlying skin of an abdominal incision, I start by closing it at the fascia layer, Scarpa's fascia, with interrupted O or 2O vicryl sutures. Next, I close the deep dermal layer with buried vicryl interrupted sutures using 3O vicryl sutures. Finally, I follow up with 4O monocryl sutures to close the intradermal, most superficial layer in a running fashion. Once the incision is closed, I clean the wound appropriately and use surgical wound closure strips to achieve further tension reduction. Wound approximation with surgical wound closure strips helps to reduce tension on the wound, thereby reducing the potential for scarring. In addition, the use of wound closure strips reduces transient bacterial contamination. To help keep the wound closure strips in place, I use Mastisol liquid adhesive. In clinical trials, when Mastisol was applied to surgical wound closure strips, there was statistically improved peel-off strength. The improved peel-off strength when Mastisol is applied ensures that the surgical wound closure strips remain intact. And it's very easy to use. First, clean and dry the area where Mastisol will be applied. Place an individual vial in the blister pack on a hard surface with the label facing down, and gently apply pressure to crush the inner ampule, releasing Mastisol. Next, peel back the lid and remove the individual vial using sterile or aseptic technique. Apply Mastisol to the area that will be covered by wound closure strips by gently squeezing the vial. Avoid non-intact skin. Allow Mastisol to dry for 20 to 30 seconds. Then place the wound closure strips in contact with dried Mastisol. To help remove the wound closure strips easily, gently, and painlessly, use Detach-All Adhesive Remover, also available from Eliquis Healthcare. Mastisol helps keep the wound closure strips in place at the skin junction, which results in a better fine line scar. In my experience, the longer surgical adhesive strips remain, the better the results. Here's an example of the type of fine line I've been able to achieve using this technique. There are some distinct benefits of using Mastisol liquid adhesive. First, clinical data shows that not only is Mastisol's adhesive capability stronger than benzoin's, it's also less reactive. In one clinical study, the percentage of patients developing contact dermatitis was 38% for benzoin and 0.7% for Mastisol. It also saves time. Its long-lasting adhesion reduces unplanned dressing changes. Because Mastisol is a clear liquid, it will not stain patients' skin or hospital linens. And finally, it's non-water soluble, so it holds securely on diaphoretic patients. In summary, I have an easy way to remember the enhanced wound closure techniques that I demonstrated. I call it my principles of 3 and 3. There are 3 important scar management guidelines for minimizing abnormal scar formation: tension reduction, tension reduction, tension reduction. And there are 3 things I'd want you to remember about Mastisol. It helps prevent wound closure strips from curling or lifting prematurely. It stabilizes wound closure strips, which reduce tension at the incision. And it's proven to reduce the risk of contact dermatitis versus benzoin. If you follow these enhanced closure techniques using Mastisol to secure the adhesive tape, I'm confident you'll see a difference in your patient's scars, and they will too. Thanks for joining me today. Look for more videos in our series, Enhanced Wound Closure Techniques, at eloquisthealthcare.com.